right, everyone, why don't we get started? My name is John Smolin. I'm a practice professor of law at Temple Law School. I'm also the executive director of the Center for Compliance and Ethics. I want to welcome everyone to today's event on mental health, organizational risk, and corporate culture. I think it's going to be a really important discussion. I'm going to turn it over soon to Abby Hazlett, who's on our advisory board as well, and we have other members of our advisory board as well as Nicole, but I'll let Abby do introductions. But I just want to say this is exactly the kind of event that we want to do at the Center for Compliance and Ethics. Our goal is really to advance through interdisciplinary discussions the practice and understanding of compliance and risk management and ethics. And this is a particularly timely and important topic. And we're really happy that so many of you could be part of it. And I'm incredibly appreciative to the panelists and to Abby and Kiley and Bea and Tamsin Fast from Aramark, who've been kind of drivers within our advisory board for us looking at this topic. And I think we'll have a great discussion. So with that, I'm going to turn it over to Abby.
Thanks, John, so much, and welcome everyone. Thank you so much for joining us today. When we started planning this event, we didn't even realize that May was Mental Health Awareness Month. So some serendipitous timing for what I think is going to be a really important conversation and hopefully give everyone on this call some things to think about and some ideas of things you can take back to your organization to address mental health and wellness. Something that has become such a focus over the last 15 months or so, which has been long overdue. With us today, we have Kiley Smith-Kelly, as John said. She's a partner at E&Y, and I'm lucky enough to also call her a friend. She's going to start us off by sharing a little bit about the impetus for this event and some backgrounds, takeaways we've had on conversations leading up to this. And then I'm going to moderate a panel with Dr. Nicole Cammack, who is the president and CEO of Black Mental Wellness Corp. She's a clinical psychologist with her degree from George Washington and has a lot of really interesting perspective given her background and expertise on how this affects employees. Also joining us is Steve Harris, who's the Chief Compliance Officer at Lincoln Financial. He's been there for about 4 years. Before that, he was Chief Compliance Officer at another organization. And finally, Janet Holcombe, who is the Chief Compliance Officer at Children's Hospital here in Philadelphia, lovingly referred to as CHOP by people who are from around town. And so I'm going to take them through a series of topics, answer questions along the way. We want to hear from all of you. Any questions you have, we'll save some time at the end for questions, but you can also use the chat function to enter questions. Kiley's going to be keeping an eye on that and interrupting me as we go to ask any questions that any attendees may have. So with that, Kiley, do you want to start us off?
Sure, Abby. Thank you so much. Hi, everyone. As Abby mentioned, I'm Kiley Smith-Kelly. I'm a partner in EY's Forensic and Integrity Services practice. Really happy to be here with you. Also really happy to be talking about this topic in general. Compliance as my main area of focus from a career perspective, but also mental health as something I'm really passionate about talking, not only in the community, but professionally, and really reducing the stigma around mental health concerns. So as Abby mentioned, over the past couple months, we've collaborated with Troutman Pepper, with Aramark, and with Temple's Center for Compliance and Ethics to do two things. One was to launch a survey, a widespread survey sent to chief compliance officers and compliance executives to ask them some pointed questions around not only their current compliance programs and how they're being affected by the pandemic, but how mental health is being addressed within their organizations. We also, after that, held a targeted chief compliance officer roundtable where we also gathered some insights from key folks to learn even more detail anecdotally and or learn some personal stories as to what's going on within certain companies and how they're addressing that. So what I'm here to do just for the first couple minutes before we jump into the panelists is really just provide an overview of what we learned through the survey and through that roundtable session. So 3 main takeaways kind of coming out of those two data areas. And the first is around just compliance program effects and effects on the compliance team, the biggest impacts. The first is that, the majority of companies that we've spoke with have identified kind of stress fatigue and fatigue as some of the biggest factors that are influencing compliance risk within their organization and the potential for compliance violations. There's a lot of companies cited there's more opportunities for risk exposure. Folks are more likely to cut corners. There's rationalization of potential bad activity due to so many things going on in people's lives, so many people being affected disproportionately by the pandemic. And also that this has created less likelihood through lack of connection for people to actually speak up about things they're seeing or things that they're experiencing, due to potential retaliation or loss of job. It's such a critical moment in the country and in our economy. We've also heard that, many companies think that they haven't even seen necessarily the brunt of the compliance risk manifest yet. And so we've spoke with and understood from many companies that they're kind of doing like a look back review on some of the key high risk activities related to their business and continuing to do monitoring of high risk activities now and into the future as the pandemic slows down, but also is continuing. So that was one of the main impacts. The second is kind of on the flip side of things. And this was really nice to hear anecdotally and through the survey, which is that many companies have actually also seen a high increase in employee collaboration. So, the focus on team morale, the focus on mental health, and therefore the proliferation of a speak up culture. And that was really due to the intentionality of the the outreach that came from leadership and then was really driven down through the organization, through managers, colleagues, et cetera. And so just being super intentional about connecting with others, understanding, hearing how they're doing, team building in the remote environment. People have found that they're actually interacting more with each other and through global collaboration in this remote environment, and that the remote environment has actually broken down barriers to having more people involved in key and important conversations and decisions. So that was a really interesting and good thing to hear from compliance executives. The main thing in that is that we've heard that creating a culture of trust is really paramount at this time and requires leadership, not only from compliance, but clearly across a whole company's leadership team to really double down on making sure that you're building a culture of trust within the organization, which ultimately will lead to a better speak up culture across the board. The third point that I'll raise here is that, and we'll go into this in more detail through the panelists, but that most, if not all, companies have increased their mental health resources for employees, such as flexible work hours, mandatory time off, or elective leaves of absence. We've seen a lot of companies provide better access to mental health resources, whether it be through their EAPs or employee assistance programs, through specific health and fitness plans, additional access to counseling. A lot of organizations are leveraging their current existing employee resource groups as kind of peer support groups to stay connected to each other. And others that we've seen have been, actually providing detail around meditation, sleep apps, fitness apps to just help with the well-being of individuals within their organization. I'll have one last takeaway, and then I'll hand it back to Abby. And, you know, as I spoke about in the very beginning in my intro, and a lot of us have seen this through our discussions, is that, you know, if there is one silver lining coming out of the pandemic, it is that, you know, through this, there has been a huge focus on mental health. And, you know, we'd like to see a continued open conversation about mental health in the workplace to reduce stigma, and to also really double down on how important the well-being and the mental health of companies' employees are to the success that it has within its sector. So thanks, Abby, for letting me give some key takeaways, and I'm excited to hear from the panelists.
Thanks, Kylie. I think your last point is so important and part of why we want to do today. I think everyone has realized more than ever through this year that businesses are only as successful as their employees. And that is ultimately every business, regardless of what sector it is, whatever widget you make, your employees are really what make or break you. And so there's increased attention and concern justifiably to make sure our employees are okay through all of this. So we are going to take today with the panelists in 3 parts. We're first going to talk about what the issue is. And that may seem self-evident, particularly if you're interested enough in this panel to sign up. You understand what mental health is, but we're going to turn to Nicole to talk us through from her perspective and with her expertise what the issues are and what's factoring into employee wellness and mental health. Then we're going to talk about what the risk is to companies if they don't do anything or they don't change the way business is currently conducted. And Janet and Steve are really going to lead us in that conversation to talk about the risks they're thinking about as compliance officers within their organization. And then finally, we're going to talk about solutions. This is a big issue, and there are a lot of problems and there are a lot of tentacles that come off of the main problem. And so none of these solutions are perfect. None are necessarily easy. Some of them are really expensive. But we want to offer you sort of a menu of things that we're hearing and seeing within our organizations, that Nicole is hearing and seeing with the work she's doing that may help move companies forward as they tackle these issues. You'll hear us talk a lot today about sometimes, you know, small steps are the most important ones. So we'll give you some big ideas, but also some small ones that hopefully have an impact for your employees. So let's talk about the issue first. Nicole, this is your area of expertise. Let's talk about mental health and let's talk about wellness. Can you tell us what those 2 concepts mean to you and how you think about them in your work?
Sure. So when we think about mental health and wellness, I think sometimes we use them interchangeably and that there are these aspects that may overlap. I think oftentimes people often say mental health, and they may also be thinking about like more mental illness. So I think we just have to think about the spectrum of what that means. We all can benefit from mental health. It is the things that we do to take care of ourselves, our health, our well-being, how we're thinking, how we're getting through, how we're feeling, and really putting in that time to focus. One, I think an important thing during this time is acknowledging what it is that you're even feeling. So oftentimes we're going through stressors and it's like, I just need to get through. And as we think about this last year, so many people were just like in this sort of survival state that they weren't able to process. I don't even know what I'm feeling or what I need or what's going on. So mental health to me is that really taking care of yourself, being in the moment, understanding what it is that you're feeling, what you need, so that you can do the things to take care of yourself. So that may include some wellness strategies as we think about meditation, exercise. Yoga is a really good one. We think about journaling, practices like that allow you to slow down and sort of think about, release any emotions that come up in a healthy way. Think about what you're feeling so you can know what you need. Wellness could also be getting sleep, which I can't say it enough. So often people come in and they are talking about, I don't have energy, I can't get through, I don't have motivation to do anything. And when we assess their sleep, they're not sleeping. They're not getting that adequate rest, which we all need. So sometimes it's sleep when we think about wellness. And it could also be like, wait, I'm having some challenges. I'm doing these things. I'm trying to take care of myself, but I'm still struggling. I need more support. And I think it's important that we can recognize that, and that we know what to do when those feelings come up, and that it's also okay to ask for help. I feel like this last year has been something unlike any other time. And it was something that we're all navigating and trying to figure out together. And so, of course, we're stressed out. Of course, it's affecting us. And so asking for help, seeking that help, going to therapy as needed, seeking out a mental health professional is all a part of how we take care of ourselves. And I compare it to the same thing. I work in a primary care office, and I often, tell my people like, well, when your blood pressure went up, what happened? Like, oh, you noticed something was wrong. You came to the doctor, they sort of tested your blood pressure. And then they gave you a treatment plan. They told you this is the medication you need. They told you to exercise, how to reduce your stress, all of these things. So why do we look at mental health any differently? It's the same thing. How can we think about what you're feeling? Here's your treatment plan. Here are some strategies that you can do so that you can feel healthier and have some ways of managing those stressors.
Nicole, I think that's all so important for us to think about, that sort of spectrum of wellness, mental health, mental illness. I think one of the things that's been a barrier to people asking for help is that stigma that comes with it, that sense of this shows some weakness or some failing. If I just worked harder or did more or was more positive, I wouldn't feel so bad. And one of the things I've heard you talk a lot about in the Black community is this expectation of strength. Can you talk a little bit about how those cultural expectations and norms really impact whether people will seek out help?
Absolutely. So when we look at cultural norms, there is this, it's sort of out there, like you should be able to handle this. We are people who have come from trauma and all of these things. And, our ancestors did it, and you should be able to. And I also think it's like this badge of honor for being able to, how much can you handle, I guess, or how much can you endure? And the flip side of that is that people are suffering in silence because they now don't feel comfortable to say, I need help, because it's the fear of someone looking at you as weak or unable to do something, or that maybe you're not trying hard enough. Maybe you're not doing enough because you should be able to do this. And so a lot of people suffer in silence. I've worked with so many people where even in the therapy room, it's like you can see the stigma is present there. So like not wanting to say or acknowledge certain experiences or feelings, or like trying to hold back tears and like apologizing and saying, I shouldn't be crying right now. I should be able to handle this. Or not even being able to like notify family that they're in therapy. It's like, no one knows I'm here because I'm so afraid. And, I remind people all the time that it takes strength to seek therapy. It is like for you to sit in that chair and be vulnerable to a person and to go into the things that so many people would rather suppress and not deal with. That is real strength, because you continue to show up and face these parts of you that are hard, or they're sad, or it makes you worry, or it reminds you of something that you don't want to think about right now. And the benefit of that is, as you're working through those difficulties, as you're showing up for yourself, the other side of that is, what if you learn how to manage it? What if it doesn't feel as heavy after you finish therapy? What if you have some strategies to get through when you're having those difficult times? Those are the benefits. And so really trying to provide those safe spaces for people. The real strength is in going to therapy. And I think that's something we all can do it's just normalizing those conversations, checking in with each other during these times. How are you doing? Like, no, really, how are you doing? Because we're all so good at saying, oh, I'm doing great. Everything's wonderful. It's like, this has been hard. So being able to, check in with each other and normalize those conversations. And when people say they need help, I think sometimes it's the negative response they get from other people that is like, ooh, maybe I shouldn't say anything. And if we could work on that, like if someone comes to you and say they went to therapy, or I think I need a therapist, if they're opening up to you, how can you be supportive in that moment?
I think it's so great to think of seeking out therapy as a brave act, and that really transforms the stigma around it. And I'm guessing there are a bunch of high achievers on this call who take a lot of pride in being able to handle everything. But if we put out a poll, we'd probably find a lot of people who are in therapy too. And I think that's so great to talk about openly with family, friends, colleagues, and show that it is a sign of bravery. Mm-hmm. You alluded to the year that it has been. We have been through a lot. Periodically with my friends, we sit down and sort of tick through everything that happened since March 2020, and it's a lot. And so we could talk about any and all of those things. But could you talk about generally in normal times and in this year, what factors into people's wellness and mental health?
Mm-hmm. So I think just in general, I try to think of it like, okay, at any point we can all benefit from therapy or have some support. But I think what factors into that is, if you're having multiple, either you're noticing you're functioning in different domains. So like maybe you're having challenges in different areas of your life. So you're falling behind at work. It's like, I just can't keep up. Like I used to be able to do all of these tasks and now it's taking all day. Or it's really hard to find the motivation at work. Whereas before it was like you're flying through everything. Maybe you used to work out a lot and you're not doing that as much. Or for some people, it's even going down a different pathway. Like they notice like, wait, I used to just drink every once in a while and now it's happening all the time.
That's a big one this year. There's a lot of drinking happening.
Been huge. So it like started out like, oh, I'm home, I can have a quick drink. And then people were like, wait, I didn't realize how much I was drinking.
Yeah, it wasn't cute after about 3 weeks of it. Yeah.
It was like, yeah. And I think like those are signs when you're noticing those changes in all of these different areas of your life, where it's like, you have to get control, like what will help you? That is a signal that something is, a little off, and what will get you back on track. And so that's when I would recommend people seek out therapy, like really seek it out. But I also say that we all go through stressors. So it could just be a difficult time, a difficult moment. I often ask a question, have you ever been through this before or something similar? What got you through? Because a lot of times we can go back to what we've used in the past to get us through this current hump. And so we just start taking a list because you're building up your toolkit, which may include some mental health strategies. It may include some wellness strategies, and you're going to try them all out. So we'll talk about what's gotten you through. We'll talk about supports and connections. That is so important. And I think this last year highlighted that for us when we couldn't get that face-to-face interaction, that connections with people who make us feel good, where we feel like ourselves, where we feel like we can be vulnerable, where we can have fun, is important. Who can you connect with? What can you do? I do a lot. It's called behavioral activation, but it's like getting up and doing something. So getting out, it was like, for so many people, I would just say, could you go outside and sit on the porch? Could you take a walk around your neighborhood? Could you feel the sun on your body? Get up and do something. So what is that movement that you can do? It can be as simple as a walk. You can try and exercise, just something to get you going. And the reason you start off with these strategies is you're really trying to sort of it's like a jump start. You're trying to get things going so that you can see when I'm doing these things, when I'm getting my sleep, when I'm exercising, when I'm connecting to the people around me, if I'm having those intense emotions, what are my releases? When I do these things, is it helping? Am I able to feel better? Am I able to get control over this? And then that's a good sign. If you are doing all of these things and you're not, that's when it may be a nice time to seek out, a mental health provider.
Yeah, I think that concept of the toolkit is such a great one because it gives you options given the stress you're facing. And that's a segue to Janet and Steve. I wanted to talk to both of you about what you think is impacting your employees this year. There's been a pandemic, there has been a social justice movement, there has been kids at home. I've met everyone on my team's house cat this year. It's been something. So Steve, what are you hearing from your employees is really impacting their mental health and wellness?
Well, Abby, it's all of those things. I've been having conversations, one-on-one conversations with everyone in my organization much more regularly since the pandemic started. And, people are opening up about all kinds of things. Nicole was talking earlier about, sleep. And in particular, I remember having conversations with a couple of people who are younger single parents of young children who are, especially during the early days of the pandemic, were basically having to deal with being caregivers to their children and in some cases homeschoolers to their school-age children all day long. And then we're having to work late into the night in order to keep up with their work. And they were, getting 3 or 4 hours of sleep a night. And they were, some of them were just really incredibly stressed by that. I was reading an article just yesterday actually about that referenced Abraham Maslow and the hierarchy of needs, which I rang a bell from when I took Introduction to Psychology a million years ago. And I think anyone who ever took an Introduction to Psychology course probably heard about Abraham Maslow, and there was some reference to Abraham Maslow and the ladder of needs. But I was struck as I was being refreshed about what those concepts were, about the parallels to all the different issues that are being manifest in the workplace. Just the 2-second refresher on Maslow is that at the bottom you've got your basic physiological needs. You need food, water, sleep, the things you need to stay alive, and then above that you've got safety needs, and that can encompass not only personal physical safety but emotional safety, financial safety, and other well-being concepts, which are part of the issues that we're talking about. There above that, there's belongingness and love, the need for emotional connections, family, friends, and intimate relationships, which are all interfered with during the pandemic. And then esteem, the need for rewards and recognition. We're talking about rewards and recognition all the time, and we need to think about that in a new lens, through a new lens in this environment. And then ultimately at the top of that ladder, the goal of self-actualization, sort of achieving your full potential, which encompasses concepts of ethics and morality, as well as other, strategies to achieve potential that have applicability in the workplace, like, career development and professional development. So I was really struck by how then all the needs that I've heard about from employees are ultimately basic human psychological needs that you can talk about in psychological terms as well as workplace terms, because ultimately, no matter what lens you look at it through, these are the things that sort of motivate us and sort of guide our behavior.
Yeah, I think that's such a great way to think about it, because our foundation has been completely rocked over the last year. I think I am one of those parents of young kids. I learned very quickly last March that I cannot do 3rd grade math. But I kept thinking about, from my very first visit where I took my now 10-year-old to the pediatrician, the 2 things they said that we must do as parents are give them consistency and keep them off of screens. Well, that was out the window. I mean, they have never looked at a screen so much, and they've never had so much inconsistency in their lives. And I think, that's the advice for when you're raising kids, but that's advice for us as adults too. All of that, all of our foundational things that keep us going day to day really got rocked. Janet, you have an interesting job because you have so many different people who work at Children's Hospital. A lot of them kept working, seeing people face to face through this, which must have created a unique stress for those employees. Can you talk a little bit about that?
Yeah, sure. Definitely. I mean, it's been the case that healthcare providers, nurses, doctors, students, the like, have been experiencing burnout since well before the pandemic. It's been a pretty big issue with healthcare providers. So certainly the environment that we've had to work in now, that they've had to work in now, has just it really exacerbated those issues. And I think when you layer on top of this, the issues around equity, diversity, and inclusion for many on the workforce, that's been an added layer, both for our people of color as well as our women. I mean, we're about, gosh, our workforce is like 75% female. They're having the kinds of issues you talked about, Steve, too. The child care issues, they're enormous. And so, we've had all of that and then some. And the other piece is that we're a mixed workforce in the sense that there are people who are location critical, never have gotten off campus. And then those of us who normally work in offices are all working from home. So how do we keep all those groups working together? That raises a whole other set of issues.
Yeah, and I think the pandemic alone would have rocked so many people. But George Floyd's murder, I think, was transformational for a lot of people and sort of their experience. Nicole, I just want to give you a little bit to talk about what your perspective was on last summer, and how you think that social justice, diversity, inclusion really impacts mental health, especially for, in general, but also employees at work and what they face day to day, particularly if they're going to work in an environment that's not particularly diverse or inclusive.
Yeah, that, as you were even talking about George Floyd, it took me back because that was a very difficult time. And, I've seen where people have different reasons why, we were going through the pandemic. And so we're all at home and just really seeing this over and over again. And I think that, it was a difficult time, but I think
And we could do a whole panel on it, but
just that alone, because I think what happened, and as we're thinking about work and employees and all of these aspects, is that people were watching this, and you have to think about what's the stress that people have been under. And then it wasn't, I think, we know about George Floyd, but it was like this series of Black deaths that were publicized prior to. So when you think about Ahmaud Arbery and you think about Breonna Taylor, right? And then you think about George Floyd, it was the buildup. Yeah. And for so many people, those experiences, while it may not have been them directly, you have to think about the indirect impact of, I have a family member who has been through this. I've been through a situation where maybe I was in, it could have been me, or it even started to be, as I've worked with women, it's like, I think about my son, I think about my husband. And so what started happening was it's like the trauma and all of the ways that it triggered experiences, whether direct or indirect. There was the anxiety. So it was just like fears that people could not turn off, the worries. I work with veterans, and a veteran told me, he's like, my wife is making me call her when I leave home. She wants to make sure I'm where I'm supposed to be, and that, I have to be home by a certain time. And you got to think this is changing families. So that the worries in that way. And then there was the aspect of just sadness, the hopelessness. I thought things had changed. I thought things had gotten better. And together, all of those things, it was just heavy, and it truly impacts people. When we look at racial stressors, it shows up similarly to trauma. It shows up as depression, anxiety, changes in your sleep. Sleep is huge for everything. Changes in your sleep, that low motivation, just that hopelessness, that down feeling, I don't want to do anything, I don't want to connect. And then the feelings of I'm not safe.
Yeah.
Where can we be safe? And those fears. And so it's so many ways that it shows up. And I often tell people, like, we're thinking of these huge events that happened and that were televised, but we also have to think about what are those racial stressors that show up that the everyday person may not observe. So when we think about microaggressions, what is that like? And in the moment, it just looks like a little incident, but over time, what is the buildup of it? And I think that that's why I feel, because it was like trying to make sense of it. I think that's why, as we're thinking about these racial and social injustices, why DEI became a key part of it, because they're the same for so many people. It's like all intertwined. Like how much of this is happening and what does that look like, you know, in the community? What does it look like at a job? What does it look like at my child's school? And so you start seeing it in these different ways. And so I think that for many people, they also don't think about, as you're watching this over and over again, what does that impact on you? Watch it. I've told so many people, like, turn the TV off. Don't watch it. You've seen it, or you know what's happening. Stop. You don't have to, because as you're doing that, each time you're doing that, it may be contributing to those underlying stressors that we just talked about. It's sort of like just reconfirming, see, we're not safe. And it's like, but you're watching that same thing over and over again. Now you're getting all the details. I don't know, for some people, I think it's important to protect your mental health, and you can inform yourself without overwhelming yourself. And so I think that that was a huge part of what happened. If there's any outcome, I think that it's been nice to see the ways that companies are being intentional about DEI. It has been in a way that I haven't observed before. And I think that when we do that, we create environments where everyone feels safe, everyone feels included, you build community. And even as these things are coming up, I think oftentimes people want to avoid it. They don't want to talk about it. You might not want to acknowledge it because sometimes it's hard to find the right words, or you don't want to offend someone. What I've found is, like, when you do that, people then feel like, well, oh, I must not be important. They don't care about these issues. They don't care about me. No one at the job can relate. Versus when you open it up, when you provide that environment, when you use whatever words feel authentic in that moment, that people feel seen and heard, and they feel like I'm a part of this community, which ultimately helps everyone, because that leads to, like, being happy on the job, feeling connected.
Yeah, and I think, you know, we are all human. We all will say the wrong things at the wrong moment, at least once a week, probably. But if you're coming at it sincerely and with care and compassion, even if you don't have the right words, and maybe you're not asking exactly the right questions, I think that can come across. And I agree with you that it has been another silver lining, as Kiley said, is it seems like last summer was the wake-up call for corporate America to be like, this is not okay, and this is not who we are, and this is not who we want to be, and we are going to invest in change. And it's going to be slow. It's not going to be fast enough for everybody, but it does seem like there's momentum behind that. And that takes us to our next part of the conversation is you know, what happens if companies don't do anything with mental health and wellness? Diversity and inclusion issues obviously are caught up in there. So, you know, Steve, what do you see as the risk for your organization and organizations like yours who don't address these issues?
The risks are they're not entirely clear, but I suspect that they encompass a broad range of potential risks. You know, we've in the ethics and compliance world, it has sort of long been understood that when people are under stress or a lot of pressure, that there's the potential that that may cause them to sort of change how they go about making decisions or change their behavior. And then as they start to engage in behavior that is sort of atypical, that could come with additional risk depending on what those behaviors or decisions are. And of course, the challenge is that with every individual, the amount of stress or pressure it takes to cause them to sort of deviate from their normal behaviors or to deviate from their moral compass is different. And that stress, as we've been talking about, can come from anywhere. It can be stress, not just the stress that's imposed from work, but we bring our whole selves to work. So the stresses that we're experiencing because of fear of illness, because of concerns about caring for children and parents and family, because of financial stress, social justice and racial issues, political issues. We bring all of this stuff to work with us, and it affects how we think and how we behave and how we make decisions ultimately. So the challenge is to try to understand if people are under stress, what are those behaviors, atypical behaviors, what could that look like? And yeah, at the one extreme, you could have people who are under so much stress that they engage in behavior that is, illegal, right? But more likely, you're going to see changes in behavior that are much more subtle, perhaps harder to track, but also have a strong probability of having a negative impact on the company. So for example, if you're a company that has call centers where you've got folks answering customer phone calls, one thing you might want to be looking at is, one phenomenon you always have in those environments are people who hang up on customers, right? What are you seeing there? Are people stressed, and is that causing them to become short and behave inappropriate with customers and phone calls prematurely? What are you seeing in terms of reports of other types of behavioral patterns like insubordination, things of that nature? These are risks that in most cases are not likely to get you into trouble with a regulator when they happen in isolated circumstances, but they do have the potential, even when they happen only a few times, to have a really negative impact on the customer experience, to have a reputational impact. And so, I think it's important that we look for a whole range of behaviors when it comes to that. It doesn't just have to be the big, obvious stuff, but there are also challenges that companies face when folks are under stress. If you're not dealing with all of these issues, you're going to have, your HR risks, related to your ability to attract and retain the talent that you want. You're going to have folks whose productivity, begins to lag because they're not as engaged as they were. Folks are going to be burned out and so on. So there's a whole range of things, and the challenge is really to figure out how do you measure that, how do you detect it, and what are some of the things you can do to surface those behaviors and address them in a proactive way.
I think I was going to say, Janet, and turn to you, that so I've done a lot of internal investigations in my career. Rarely has someone been a bad person in my view. More often than not, they're a good person who made a bad choice because they have something else going on in their life. They're worried about their job. They have, other pressures at home. So I think that's a good point to, say that whole person comes to work every day. Janet, it's not an exaggeration to say you all are literally saving lives at work, which adds another interesting dynamic to the risk you all see. What do you think about it?
So I have a couple of thoughts here. This appreciated Steve's comments. One of the things that occurs to me is that if we have a lot of stress and employees who feel they're not in a supportive enough environment, it's going to have a big impact on your employee engagement. And what could be more important for the culture of an organization is is low, then low engagement, because what that's going to do is somebody's going to think, you know, I don't feel as connected to the mission. I mean, we're all about our mission, and if they don't feel as connected to the mission, you know, it could have a big impact on how they treat the patients, how they treat one another, and just caring about doing the right thing in their work. Even if they see a problem, if they feel disengaged culturally from the organization, are they going to risk, you know, becoming ostracized for raising a question if they don't really care anymore about the organization? No. And, you know, you think about sort of the hallmark of good compliance program is that people will help you identify problems so that you can fix them. So I think the effect it can have on engagement is huge, and really a you know, a big part of the risk. And, you know, so that, and it does matter a lot when you're dealing, we're customer facing all the time. And the interesting thing there is when you're a caregiver, you know, it's not just taking care of yourself and doing your job. Like, you've got to really be caring for somebody else. And that's really, as we all know in our own lives, it's very hard to do when you're struggling and, you know, you feel like you can't even take care of yourself. How do you have enough compassion left to take care of somebody else? So, you know, it could be huge.
And Janet, what do you view your role as Chief Compliance Officer at Children's Hospital? You know, I'm sure you wear a lot of hats day to day, but on this issue, where do you see you sort of stepping up in leadership and talking about this and implementing change?
Yeah, so, you know, I think that is an interesting issue. And it's not an easy one to answer because there's a lot of people that have an interest in this. I think for one thing, for sure, as the compliance officer, I can't be absent from the conversation. I have to be part of it. You know, culture is so essential to what we do, but leaders and people on the front line have to own culture too. So we have to be in a kind of spur conversation and support it, but I don't know that we're the leaders on that. Personally, what I've been pretty involved in a lot of the culture issues, and, you know, from a number of different ways. One thing I'll just mention, we talked about risks here, and one thing I wanted to mention, you know, we deal with, and many other compliance officers, I suspect, have a role in enterprise risk. And I would say we just finished like our annual enterprise risk assessment, and a dominant theme in those interviews that we did and the discussions was the risks around this atmosphere, the challenges to people, the cultural issues. It's dominated like never before, and really has been woven into our risk plan for next year for enterprise risk. But in terms of and one of the other things that I've been involved in was, you know, we're taking a look. You talked, and Nicole, you talked about this, the whole idea of a speak up culture, which is really at CHOP, we see that if we don't have it has many implications, as it does for every company, but we think there's a big tie-in between patient safety and psychological safety to speak up. Because if we're not willing to talk about our mistakes and look and see at what we can do better and point out where we've done something wrong or where somebody else has, and feel free to talk about it without fear of retaliation, you know, not just individuals are going to suffer, but potentially our ability to keep our patients safe and always improve, which is what we're always trying to do, will be at risk. So I've been working with the team, including people from patient safety. Sort of interesting, we've kind of found commonalities that maybe we didn't know we had before in what we do. So I've been working with the group from the patient safety group, as well as HR and some of us from my office, on what can we do to help promote a stronger speak up culture. And, you know, there are many strands to this. And, you know, we are rebranding our hotline, and we're trying to take it from being something that people think they should call, this kind of came out sort of coincidentally, but just talking to some physicians who were raising concerns about, some physicians of color who felt marginalized in a particular specialty where they may be the one only person of color in that specialty. And when it was raised to them, why don't you raise this issue? Well, they didn't want to talk about it. They didn't want to be identified, which would be almost impossible to not be identified if they say, in my specialty, I don't feel like I'm being treated fairly. So then it was, well, why don't you call the hotline? And they said, why would we call the compliance hotline? That's for like business kind of issues or how we bill and code. So that was like a red light, oh my gosh, people need an outlet. It shouldn't be their only outlet, but if they need that kind of outlet, we need to make sure we offer it. So we're rebranding our hotline, and we're going to be openly encouraging people to, if you have any kind of concern, whether it's around equity, diversity, inclusion, whether it's about something else, this is a place that you can report safely. And in part of that work, we're also going to be training our leaders for maybe to get their behaviors more in line with sending the right messages of when people report, that there really is no retaliation, that we're really not going to try to find out who reported this and so forth. So that's one example, and that's been sort of an interesting, and it really came out of this atmosphere that we're experiencing right now.
Steve, what do you see as your role?
In many aspects similar to what Janet described. In some cases, there are aspects of shaping the culture and in trying to identify and manage the risks we're talking about today, where we sort of feel like we have the primary ownership role, but there are other areas where we are working in partnership with many other stakeholders that may have an equal share in shaping the culture of the organization. To pick up where Janet was left off talking about speak up culture, we've long tried to promote the idea that speak up culture is not just about speaking up to report misconduct or violations of the code, right? There's a business imperative as well as an ethical imperative behind speaking up. If people don't feel empowered to speak up and share their ideas, we're not only not going to surface misconduct and violations of the code, but we're also potentially not going to surface great ideas that people have that could lead to continuous improvement, to improving the customer experience, identifying ways that we do business that don't seem to be working, that they are experiencing at the grassroots level, and it may not be visible to more senior leaders. We need people to feel empowered to speak up about that. And to Nicole's point, we now need people to feel empowered to speak up when they need help, right? That's an aspect of speaking up that we haven't really focused on so much. But as Nicole said earlier, speaking up when you need help is an act of courage, just like speaking up to report misconduct is an act of courage. And so we're thinking about, how do we build that way of thinking into all of the training and the awareness that we do on Speak Up. But for me, our responsibilities also include other, what I'd sort of characterize as sort of foundational elements of an ethics and compliance program. If you look at the DOJ guidance for effective programs or the US sentencing guidelines for organizations, the two, sort of templates for what are the requirements, it talks about basic stuff like doing risk assessments, testing and monitoring, training, communications. And so, we're trying to look at all of those elements of our program. To Janet's point, are there ways that we could be changing our risk assessment process to better surface cultural risks rather than just primarily regulatory risks? Are there ways that we could be shifting how we invest in testing and monitoring to better understand some of the behavioral challenges as well as some of the other operational challenges that we routinely test and monitor for? Are there changes to the way we think about designing our training and communications, to better reinforce the key concepts that we want to get across that we think are going to drive the right behaviors and steer us in the right direction? The key, I think, for all of us, whether we're ethics and compliance officers or diversity and inclusion professionals or HR professionals or ESG professionals, all of us who are sort of thinking about these issues individually and together, is how do you sustain them over time? Because what we don't want is, for, a year and a half from now, for people to say, oh, remember when we had all those great conversations about race in the wake of George Floyd and all the events leading up to that, and then you never talk about it again. And, so we've done, like a lot of companies, I'm very proud of the work that we've done internally to try to, raise those issues. And we've had some fantastic conversations where people have been incredibly generous, sharing their own personal experiences at work and outside of work that have really led to incredible heightened awareness and have caused a lot of folks to think differently about how we interact with each other in the workplace. But how are we going to sustain that? And we're trying to do that institutionally. And figure out how to do that. But that, I think, is going to be one of the biggest challenges, not just for that issue, but for all of the sort of stressor issues that we are now becoming more and more aware of and wanting to deal with on an ongoing basis.
So Abby, just to jump in real quickly, I had a question come through the chat about, over to you, Janet, about how you're rebranding the hotline. Kind of what is the new brand? It sounds like a lot of folks from compliance might be interested in taking that learning from you.
Sure. So we haven't gone out publicly with our workforce about what it is, but I think I can share it. We've come up with Safe to Say is what we're calling it. And, it's a very different feel than the compliance hotline. First of all. And what I think was most interesting about the process that we went through to do this was that we got a number of ideas for names, and we worked with our marketing people who helped come up with some ideas. They wanted to know what were we trying to accomplish. And it was funny because the first time they ran the names by me and somebody who works with me, we were like, nah, we don't like this one. We don't like that one. And those were all the ones that everybody else liked. So it just showed you that we are not as in touch with things as we think we are. So that was very fascinating. And then we took some names around. I took it to my whole staff. We took it to our compliance committee. We had spoken to 2 different physician groups who had raised concerns about their comfort in speaking up and why would they use the hotline. So we took it to those groups and asked them what they thought. And there was a lot of learning that went along with just having those discussions. It shows you, this is something, Steve, I know you and I and everybody else on this call knows, but there's nothing like talking to people. It makes you better at what you do. And there's nothing more important when you're in compliance than that, having those relationships and talking to people. But we heard things, some of which that were concerning about there wasn't as much trust of leaders, of others in the organization as we would have liked to have thought. Now, whether that was individual and not symptomatic of a broader trend, who knows? But I'll just give you a couple of examples. One of the names was the trust line, and people right away said no way, because there's an irony in that. People don't trust it, so don't use the word trust line. Really interesting. And it just, that little thing about trying to find out what names would be good brought up a lot of information that we then take and we're trying to do something with. I'm trying to think, there was another one that it was something like and this we cribbed from another hotline, which I really liked, but it was going to be Chop Listens. And that was just nixed because the feeling was we don't listen, because people who raise concerns, and that, again, this isn't necessarily everybody. Chop is a wonderful place. I've been there 15 years. I wouldn't be there if I didn't feel that way. But people felt like if they did report things, that nothing happened. So that pointed out something that we know is an issue, because we can't always tell people what we do specifically in response to a concern, because often there's like an HR component to that. So you got to be kind of careful what you say. But it did make us realize that we need to have a better loop back with people about what's in it for the organization, that in having people speak up and speak truthfully, and what is it that we need to be doing more to show people that what they say really matters. So just that little exercise, it's just fascinating, taught us a lot about areas where things in our culture that we could work on more, which was great, actually.
So we've
So
now,
Abby, I've one more specific question for the panelists. I know I keep interrupting you, but I think you told me to do that. Another question, this one's for Steve. So you mentioned that, you're thinking of ways of how to sustain the shift and to encourage speaking up more broadly within your organization. Someone was asking, can you share any specific examples of tactics or kind of approaches that you're taking to ensure that it's sustainable and really woven into the fabric of Lincoln Financial Group?
Sure, I'd be happy to. As you might imagine, it's a work in progress, but based on the work that we've done so far, I'd say that we're really trying to take an approach that addresses the sustainability question both from the top down as well as from the bottom up simultaneously. So from the top down, we, through our enterprise diversity and inclusion group, there have been toolkits that have been developed for managers to continue the discussion periodically. The toolkits include short videos, short articles, and the tools that a manager needs to sort of facilitate a conversation about a particular issue, like a race or a social justice issue, for example. And we are actually tracking that those meetings are happening periodically. And the hope is that we will continue to do that. So that's an example of the top-down approach to trying to sustain it and giving managers the tools they need in order to do that effectively. But also, as I said, it's bottom-up, and we're using our business resource groups, which are the employee resource groups at Lincoln Financial. They're doing a lot of the grassroots work, and various resource groups are creating their own activities that they are sort of pushing out and making available, not only to their resource group and its allies, but to the enterprise as a whole. And so there's a variety of ways, and again, we're trying to encourage the responsibility for this and the accountability for this to come at all levels of the organization, including rank and file employees through their work in resource groups who are very invested and have done a great job in finding ways to creatively continue the discussion and create the tools to do that.
I think we've gotten like the perfect segue into what companies are doing and offering solutions. So I'm just going to build on that. We to let everyone know sort of where we're going in advance of this, we put potential solutions into 3 buckets. The first is making sure that employees feel like they're not alone, which is a lot of what we've been talking about already. The second is providing resources at all levels for employees. And then the final is, just focusing on doing the next right thing, taking small incremental steps as an organization and as employees. So let's talk about making sure employees don't feel alone. And Nicole, it would be great to hear from you. We've heard a lot from Janet and Steve about encouraging speak up culture. When companies come to you, do you have ideas and things that companies can do to encourage employees to take that brave step of raising concerns and reaching out for help when they feel like they need it?
I love the 2 examples that were given. I think part of speak out culture, if you're going to encourage employees to speak out, right? If you're providing the avenues to do that, it's almost like you have to follow through to show that your voice matters. And so that would mean like there is no retaliation. There is no trying to figure out who it is. You take that information and then there has to be action. Often what happens in these situations is people feel hopeless. It's like there's no need of speaking out because nothing's going to happen. they're not going to do anything with it. We hear a lot that some people feel it's just like a one-time thing. Like you're only doing this because this is like the hot topic of right now. You don't really care. And so it is important to think about, how do you continue this work, as Steve has already mentioned. And I think also recognizing you can't change all of it at one time. But you can take those incremental steps and continue to do things and continue to check in and continue to make modifications and provide these opportunities for employees so that over time you're making huge shifts in the culture, but also you're being looked at as reliable leadership, that you really care. You're getting that buy-in again because you're showing up for the people who are a part of the workplace.
I wanted to tag on. I appreciate very much what you're saying, Nicole. And one of the things that we're doing as we come out with this hotline, because we've been writing up the material, is we're kind of acknowledging our own vulnerability, and we're saying, you know what, we could be doing better, and we could be looping back and letting people know how what they tell us really does matter, and try to give them as much information as we can. And this is going to be a work in progress for us, but we want to do better. So I think even just how you deliver what could be a cut and dry message, I mean, because I really felt that way. I felt like this is our failing, but, you know, let's see what we can do to make it better. And I think if you deliver messages that way, I think it just so happened we were just trying to be honest with it. But I think there's a benefit to doing that and showing, you know, let's all admit we're not perfect. We don't have to be perfect. We're going to try. And we've said we're going to try to do this better, but it may take a while.
Janet, I think Kiley had a specific question as a follow-up for you that sort of dovetails with this, of making employees feel safe and that psychological safety. Kiley, do you want to ask that?
Yeah, sure. So a question was raised by an attendee around use of the term psychological safety. And if you've used that, Janet, broadly in the organization, across all different functions, et cetera, or is that something that's kind of that you speak of and maybe in compliance and HR, kind of a behind the scenes, something for you to strive for?
No, it's used throughout the organization, and we've had leadership. I mean, before this horrible year, we've had leadership retreats for all of the, I mean, I'm talking managers and above, a huge room full of people where the whole session was about psychological safety. So it is something that we talk about. And in fact, you know, we want to be careful to not, in a sense, sort of minimize the term if we're just talking about it all the time and we're not doing it right. So you have to be careful, but no, it's very much. And I think it's probably because again, I'm not as embedded in the patient safety world, but I think that concept is big there. So we're just generalizing it to more than just needed to talk about errors in care, in delivery of care, and talk about it more broadly. So we do use it openly.
Great, thanks.
Let's talk about resources. A lot of organizations in the past year have increased benefits, changed benefits. Janet, can you talk a little bit about what, if any, changes you've made at CHOP and what you think might be on the horizon on, you know, paid time off or other more tangential benefits for employees?
Yeah, I think that one of the things that they've done, which was really well received, not surprisingly, is for the first time, we have paid parental leave. So after the birth or adoption of a child, there's now, I can't remember because I'm too old to have kids, but I think it's, 4 weeks of paid leave, which would be on top of the other leave. And that's for either parent. If you're adopting a parent, it's mother, father, whoever. So that is incredibly well received for obvious reasons. And I think given particularly how much parents have struggled this past year, I think this was something I think they had been looking at, but the timing was right. And that was great. And then they do, again, we have there is more of the well-being offerings. Mental health offerings definitely are more of a focus. Digital health is a big deal. I think most companies have that, and we have more digital health available to us. Let me think. In terms of benefits, I mean, we have things interesting that somebody talked about it. Maybe it was at another meeting I was at this morning, but we have a group there. It's like a grief group, I'll call it. They have a better name. I just don't remember what it is. And it's got it started out being for, our caregivers, our nurses and our doctors. I mean, we have children who die. I mean, a lot. And as you could imagine, that is traumatic for the nurses and the doctors and the residents who have taken care of those children. So they have this group that can be there for you, to talk to you afterwards. But they've expanded that a little bit. People have lost people to COVID or whatever this year. And I know someone in one of the departments that I work with a lot, in an administrative side, they lost a close, an employee who's been there for a long time, very sad death. And this group came and met with the staff of that department to just help them work through and talk about the grief. So I think those sorts of people are thinking more expansively about those kinds of programs, which is a really nice thing.
And Steve, you all have been doing some really interesting things on employee surveys and feedback loops. Could you share a little bit about that?
Well, we've started doing more employee survey activity over the last year, and that's something that actually began before the pandemic. But that was intensified when the pandemic began. The company at an enterprise level began a practice called Feedback Fridays, where there was always a short, 2 or 3 question survey that went out to employees. At the beginning, it was focused primarily on questions that leadership needed to know employee attitudes about, to help us understand, how remote work was working, people's attitudes toward, coming into the office, and how we ought to think about our strategy. But over time, the range of issues that we've been polling people on, has broadened. So we, for example, used the Feedback Friday survey to ask about to do basically a pulse survey on people's attitudes about the ethics and compliance program and speaking up. And do they feel comfortable speaking up? Do they know how to speak up? As well as other issues. We've polled people on social justice issues. As now that we're more than a year into it, that the surveys have not been coming out every week with the rigor that they did initially, but we're still doing them periodically. And I think that that's something that we're going to continue to do in the long run as well.
Nicole, do you think increased benefits, feedback, surveys, do those sort of things in your view help people deal with wellness and mental health?
Absolutely. I love that. I wrote that one down, Feedback Friday. I love that because it gives a way of knowing what's happening and what people are feeling. And maybe it's their way of releasing. And again, if they're feeling like they're being heard, that helps. As we think about other benefits and wellness benefits, it helps because you're giving employees stress management strategies. So you're saying this is important, and we don't need to know who uses it, how frequently you use it, but here are the resources. So people don't necessarily have to disclose that they're accessing things. Sometimes something as simple as providing the information allows people to use it when they need it and at their own pace. And so I think sometimes people feel like, I don't even know where to start. Having those resources give a starting place. And in the process, they're learning to deal with their stressors in a healthy manner, which is what we want, right? And so being able to think about reminding people a lot of times, if there's an employee assistance program, utilize that. If there are wellness benefits, here they are. My work group, they had, our department did like mindfulness groups during the height of the pandemic, and it was just like no pressure, but it's a space of saying we all need something. Come take advantage of this, reminders about other services that we had. So I do think that those things help. And sometimes employees know those things are there, but they may not necessarily access it. So a reminder is always nice as well.
Yeah, and I think sometimes the reminders need to come from different people too. I mean, it is different when your boss's boss says like, hey, this is here, we want people to use it. That has a different impact than, you know, sometimes it's just not just HR, but it's HR professionals who are pushing this out and it's the same person over and over again. But having other people explain that they've, you know, used the resources and encouraging other people to do it too would be helpful.
Abby,
So Abby, I do have, oh, go ahead.
I was just gonna, if I could add on to Nicole's comment, in addition to publicizing it, the value of the benefits is going to depend on whether you're offering things that are meeting people's needs, right? So there's the fundamental question about looking at, you know, at Lincoln, for example, yes, we've focused on, you know, our employee assistance program and enhancing leave opportunities, but we've also focused on enhancing and better tailoring wellness benefits. And so it includes not only things that you would typically see, like, you know, counseling, access to counseling, referral services for, you know, folks who can help you with basic needs, like, you know, whether it's caring for children, parents, your yard, but also things like access to free online tutoring for children aged, you know, K through 12. You know, it's how all of these things fit together. Get the feedback, getting the feedback, understanding the needs of the employees, tailoring your benefit programs to try to meet what you perceive to be the biggest needs. And then to Nicole's point, promoting the heck out of it so people know that it's there and know how to take advantage of it.
But maybe that's where your Feedback Friday comes in. That is a great one with the tutoring, but that's an easy way to get a pulse of what do people need during this time. And then if there are things that is within your reach of being able to provide, it feels like it's meeting their specific needs.
Perfect. And Steve, a follow-up question for you that came out of, I think one of your earlier comments about Feedback Fridays and kind of the ongoing surveys that you've done. Have you experienced as an organization kind of a survey fatigue? And if so, how have you managed it? Or how do you advise other companies to help manage their survey fatigue?
Look, every company has survey fatigue. And my experience is that the fatigue comes largely when you're confronted with the kind of survey that you can't readily complete, like in the 10 minutes you may have between your meetings, right? So that's why the Feedback Fridays have been so effective. It's literally 2 or 3 questions you can answer in less than 2 minutes. And we have tried to shift when we do surveying that is focused on ethics and compliance and culture issues. We've tried to shift toward doing pulse surveys periodically, just a few questions here and there. But you're right, you know, the notion that, you know, we do a big employee engagement survey, but we only do it every other year because, you know, there's only so much attention that employees can devote to that and still give it their, you know, provide meaningful responses. But also, you know, being realistic, there's only so much time, you know, sort of lost productivity that we can reasonably expect to impose on our business partners, because it's not just from the surveys. If you're telling people that everyone in the company needs to take a survey and it's going to take 30 or 40 minutes, but, you know, on top of that, you've got all these training requirements and those are going to take in the aggregate several hours. There's only so much lost productivity that it's reasonable to impose on our business partners. So we are always going through this dance and negotiation about, you know, what should be the top priorities. How do we package it so as to minimize disruption to business operations and also not overimpose on people's psyches in terms of, oh my God, I got to answer another survey. So it's all very well coordinated and very well timed. And I don't know if that's a really, you know, satisfactory answer, but it's sort of, we're dealing with it as the way I suspect most companies are.
Great, thanks. That's helpful.
We have just about 9 minutes left, and I want to make sure that, you know, people, if you have questions, throw them in the chat and we can answer them in the next 9 minutes. We've talked a lot about, you know, small incremental changes and, you know, taking baby steps, not trying to solve this overnight. I thought I'd ask you all to share what you see kind of coming on the horizon. And one question just popped up about collaboration exhaustion. I think that's a great one, especially as we think about transitioning back to in office, which it seems to be coming. You know, Janet, you know, thoughts on that question about collaboration exhaustion, or what challenges you see coming in the next 12 months for Trot?
Yeah, I mean, that is, I think I alluded to already. I mean, that's sort of key to what we do in compliance. So you do have to ask yourself, how are we going to do that? I certainly am. I mean, every day I'm like in front of the screen all day long, and it's really, truly exhausting. Strategies for dealing with it. I mean, I think you have to, I think maybe we overuse the word collaboration a little bit, and maybe that's my own bias, but it's starting to feel a little bit forced. You know, some things just happen naturally. You've got to let them happen naturally. You know, so one of the things I've done, you know, I have much more one with every person who works in my department. I just have a half an hour, whatever it is, once every 2 weeks or something, with people who I normally wouldn't have a one-to-one with. And we just talk about, like, how's life? Is things okay? Is there anything I can do for you? And to me, that's part of collaboration too. And I do that not within just my department, but across the organization. I'll have like coffee virtual, or just sometimes I'm trying to change it up now and doing more phone calls because I'm getting exhausted from the camera. And it was funny, I had set up a call with somebody in our finance department, and he said, I'm so glad you called me because I can walk while we talk. I can pace around the house. And so we're both like talking and out of breath and talking, and it felt great. You actually got to move your legs. So, you know, I think we need to get creative and thinking about collaboration is not just everybody sit in a room all the time doing stuff. I think there's more. There's individual collaborations. There's talking to somebody and learning something they're doing, and then finding out somebody else is doing something similar, and then you kind of bring it all together. So it's kind of a very loose answer, but I just think we have to develop new strategies, and we have to be creative about it. And I think there is this myth that we're all going to come back, and we're all going to, even if we're hoteling, we're all going to be sitting in this little space, this little table, and voila, we'll be collaborating. I don't think it, Nicole, you're shaking your head. I don't think it works that way. It really doesn't, at least in the kind of work I do. It's relationships, and some of it just has to, you know, if it feels overly forced, I don't know what that's going to do.
Steve, what do you see coming in the next year? Back to the office?
Yeah, and that's actually coming in the next year, but actually we're actually going to be making announcements literally later this week and next week. And I know I see that we've got some Lincoln Financial folks on this who are listening into this discussion, who are probably very eagerly awaiting, you know, news on what it's going to be. Yeah, so that's going to be a big issue for us over the next few months. We had announced early on that the earliest we would reopen our offices is October, and now we are at the stage where we're announcing well in advance of that what the transition is going to look like between now and how we get there. And we have also announced that going forward, you know, work life is going to be very different. There are going to be very few people who go into the office every day. And I want to say it's going to be like only 3% of the entire workforce is going to be going into the office every day. And I think in our legal and compliance department, no one will be going into the office every day. Most folks in our world will be either working, and I'm not sharing any state secrets here, anything that hasn't already been shared at a high level. Most folks in our world are either going to be working, continue to work from home on a permanent basis, or are going to be on a flex model where they're coming into the office typically a couple of days a week. So there's going to be a whole big change in how we think about work, how we think about collaboration. And to be fair, we don't honestly know what that's going to look like. You know, this is going to be a it's going to have to be a test and learn approach. And for my colleagues who are listening in, you're all going to be, I think you all know, you're going to be finding out over the next days which of those buckets you're going to be falling into based on your role.
Nicole, I'm going to give you the last word. And this would be a great chance for you to plug your business too, because I think people listening are going to continue to grapple with these ideas going forward. So what do you see as the big stress? And tell us a little bit about where we can find you.
Yeah, I think it's interesting because in the beginning, people were worried about working from home, and now people are worried about going back.
Yeah.
Fear of going back is not just related to COVID and being in the office, but it's that the way people were living didn't work. When I think about myself and like, I live in DC and traffic is starting to get a little heavy again. I'm like, no, we had a system, don't do this. But when you think about just the amount of stress and go, we were all under, like traffic and getting to work and rushing to get kids and rushing back home and rushing to cook dinner, I think that it was a lot on people. And so some of that sort of fear about that is coming up. How do we do this? What is it like? And I think for so many of us, we also have to think about going back to being way more social than you were before. And in the beginning, it may take a lot of energy. It may take a lot. You may not have that natural inclination where we're becoming accustomed to having the space and not getting close and not talking. And I think that a lot of that may change. So those are some of the things I think are happening. And of course, we will continue to have like DEI and continue to work in those ways. So I'm with Black Mental Wellness. We're a group of clinical psychologists. There are 4 of us, and we got together. Honestly, I was working on a military base, and it just was like so vivid to me, the lack of resources that I wanted to provide people that just were not there. And I wanted it to be in a language that they could understand. So we partnered and we developed information, resources that are free to the community. You can go to our website and learn about blackmentalwellness.com, learn about mental health, but also what are some of the different mental health disorders, what are symptoms, when should you get help, questions that you would ask a therapist that you may not be sure about. How do you even find a therapist? And also coping and wellness strategies. We put on free programs and things for the community. We also work with companies, corporations to provide trainings and workshops. And then we have we started a mental health conference, which the next one will be November 6th, and just a wealth of different topics. So
thank you so much, Nicole. Thank you, Steve. Thank you, Janet. This has been a really great conversation. Hopefully we can continue it. John, do you want to say any parting words?
No, this was great. I mean, this is the contributions of everyone. Abby, great job kind of facilitating the conversation. Great questions from the audience. We want to just keep building on this, and we want to have the kinds of discussions. That's what we're here for as a center, is to create forums for these kinds of discussions. So thank you all for doing it, and thanks to everybody for coming today.
Thanks, everyone.
Thanks again, everyone.
Bye, everybody.